Welcome back. Thanks for staying with us. The Universal Healthcare Access Coalition says the national health insurance process is not progressing as it should. The coalition says this is because no health system reforms have been implemented since 2004. Now, during the State of the Nation address, President Cyril Ramaphosa announced that government would proceed this year with the preparatory work for the establishment of the NHI.
The proponents of universal health coverage are looking forward to Finance Minister Enoch Godongwana's budget speech. Thus follows President Cyril Ramaphosa's State of the Nation address. Ramaphosa emphasized that once the NHI is fully implemented, it will save many lives. However, the Universal Healthcare Access Coalition says while government has focused on the NHI, the current healthcare system has been left unattended.
What has happened is that while they have been busy with this NHI, they've neglected the two major systems of healthcare, resulting in a decline in access to public services and a real degradation of its service quality and an explosive growth in the private sector without any market growth. So prices have gone up, and that's not helpful for the private sector either.
At the same time, Discovery Health says the NHI should not discriminate between South Africans.
The principle underpinning NHI is one that I think all South Africans should support, because what it envisions is a healthcare system which provides quality healthcare to all South Africans, and that's certainly something that I think is we should aspire to. And it was encouraging to hear the president talk about investment in infrastructure in the healthcare sector.
The coalition says the NHI in its current form raises a multitude of concerns.
The NHI proposals themselves, which unfortunately have become an obstacle to progressive health reform in South Africa now for a considerable period of time. So the reasons, I can put sort of three basic reasons here. The first is that the proposals are not in harmony with the current health system. So that's including both the public and the private subsystems, and are generally regarded as harmful to health access. They haven't really been designed with access in the specific modalities of the design. Largely people promise access, but there are no measures that are introduced that will ensure that access will actually be improved in any part of the health system on a sustainable basis.
Meanwhile, the Universal Healthcare Access Coalition has proposed a framework for healthcare reform that it says is capable of more immediate implementation and designed to work within the country's fiscal constraints rather than raising the tax burden on citizens. Nothando Makutulela, SABC News, Johannesburg.